Okay, we touched briefly how to set up the front table for the vet station, which is basically a nice clean table without a bunch of scratches or stains, a medical waste bin under it, and a trash bin. Now the back table is where, at this station, we keep all our supplies. A really important factor about this is keeping it looking orderly. We don't want clients to see a mess and then walk away wondering, did my dog even get the right shot? It was so messy, maybe they picked up the wrong thing. So an orderly station is very, very important. Now you have several bins full of equipment, so it's important that they're in a place that is easy for you to access during the clinic, but it also has to stay looking nice. So the crash kit, that has to be readily available, just set it here. This is your vet tech box, and there's things I left inside that you're not going to need, except maybe rarely. But what I did leave out were muzzles, leashes, and your cat gloves, because those you may need, and that way you just don't have to go inside the bin. But I took everything else out of the bin that I needed and set the bin neatly here. Okay? The vaccine cooler, very important. You're going to need this during the clinic, so it's easy access. I can simply pull it out and open it up and get what I want, but it's out of the way but still looks neat. And then over on this side of the table, I have your syringe bin, but I've already taken out what I needed and I've set that neatly on this side. So again, neat. Don't leave all the shopping carts that you borrowed from Petco cluttering up your station. Return them to the front of Petco and put your bins, once you've emptied them, in a neat order under your table. Now the table itself, there's a specific way to set this up also. So Shane, come on up, let's get some close-ups here as I explain it.
All right.
Starting on the left side of the table, as you face it, you have your doctor board. And on your doctor board is going to be your sheet to write the blood tests, the serial and lot number sheet, which you will put the labels from the vials on. And if you are in a state that has microchipping, you're going to have a microchip log. The pens for your clinic that you're going to use will be found at the beginning of the clinic inside this. And what you do is you pull the blue copy off the back of the medical record and you put it in here at this station. Okay? Also, on this end of the table you have your cleaning supplies, your hand disinfectant, table cleaner, peroxide alcohol, paper towels. Moving this way, you have the box with your blood tubes to collect blood in, small syringes for getting blood, small needles that we use on little dogs and cats, and then your supply of the regular needles and syringes. This is dewormer, and then we have some oral Benadryl that we give to small animals. Okay, now your vaccine trays. This is really an important part and what will be the hardest for you to pick up if you're brand new. There is a tray to put the vaccines once you pull them up for cats, and it'll be labeled with your cat vaccine names. And then there's a tray for dog vaccines. This was labeled at one time, but just with repeated cleaning, the labels have come off. But this tray is for dog vaccines. So right above where the vaccine goes, if this is the feline leukemia slot, the feline leukemia vaccines sit up there. And then your feline distemper, the 4-in-1 slot, the feline 4-in-1 vials sit there. So these line up and they look neat in appearance, and they're easy. If you're going to take it from there, it's going to go here. Okay? Rabies comes in a multi-dose vial. It's called a 10-dose tank. So at the beginning of the clinic, you're going to take out 1 or 2, maybe 3 vials if it's a really, really busy clinic, and you're going to pull up 30 rabies in advance, and you're going to set them there. The first slot is for rabies. This next slot is for Bordetella. These are your Bordetella vaccines. So the first tray that needs mixing corresponds with this first slot that needs something. So it kind of lines up. This slot is either this corona or your combination corona, and we'll get into that later. And then this slot is your distemper parvo with lepto, which is 6-in-1, and these are your 6-in-1s. So this does go in order of the slots that the vaccines are going to go into. Now also in your cooler are additional types of vaccines, but we don't pull those out till we need them. That is the Puppy 5-in-1 and the Puppy 5-in-1 plus Corona. So if one of those patients that needed that arrives at your table, that's when you pull it out. And if you're going to use a 5-in-1 plus Corona, then you would pull it up, mix it, and set it right there, right in the tray cover. You can even turn this over that says what it is and put the mixed vaccine there. Now also in your cooler will be the regular 5-in-1 and what we call a control box. What goes in this box are partial vials that you have left over at the end of the day. Let's say you used half of this bottle and it's not a full bottle, but there's some still left. It'll go in this box. Injectable Bordetella, we don't usually keep this out. We only use this if we can't get nose drops form of Bordetella into the dog. Epinephrine, this is in case of an emergency. Your veterinarian will tell you when to pull that out. And you might also have some sterile water in your control box. Okay? So any partial vaccine tanks at the end of a clinic go into here. So when you're setting up at the beginning of a clinic, look in this box, and if you have a partial vial, use that up first and then pull a new vial out of your cooler. I think that's it.